Many women are unaware that they have a condition that can affect their fertility and childbirth until they visit their physician. It is then and only then that millions of women learn of a condition called PCOS. Polycystic Ovary Syndrome, or PCOS, is a common hormonal disorder that affects millions of women worldwide. It's a complex condition that can have a significant impact on a woman's health, fertility, and overall quality of life. Understanding PCOS, its symptoms, how it is diagnosed, and the available management strategies is crucial for those living with the condition. This detailed video will explore all aspects of PCOS, offering insights into effective ways to manage its symptoms and lead a healthier life. What is Polycystic Ovary Syndrome, or PCOS? PCOS is a hormonal disorder characterized by a combination of symptoms that can affect a woman's menstrual cycle, fertility, appearance, and overall health. The exact cause of PCOS is not fully understood, but it is believed to involve a combination of genetic and environmental factors. Women with PCOS typically have elevated levels of androgens, which are male hormones, and insulin resistance, which can lead to various symptoms, including irregular menstrual cycles, excessive hair growth, acne, and obesity. The name Polycystic Ovary Syndrome comes from the presence of multiple small cysts on the ovaries, although not all women with PCOS have these cysts. PCOS is a leading cause of infertility and is associated with an increased risk of developing other health conditions, such as type 2 diabetes, heart disease, and endometrial cancer. Early diagnosis and management are essential to reduce these risks and improve quality of life. Epidemiology of PCOS. PCOS is one of the most common endocrine disorders among women of reproductive age, affecting an estimated 5 to 10% of women worldwide. The prevalence of PCOS varies depending on the diagnostic criteria used, but it is generally agreed that the condition is underdiagnosed and underreported. PCOS can affect women of all ethnic backgrounds, but studies suggest that it may be more prevalent in certain populations, such as South Asian women. The condition is often diagnosed during the late teens or early 20s, but symptoms can begin at the onset of puberty or develop later in life. Causes of Polycystic Ovary Syndrome. The exact cause of PCOS is unknown, but it is believed to result from a combination of genetic, hormonal, and environmental factors. Some of the key factors contributing to the development of PCOS include 1. Genetics. PCOS tends to run in families, suggesting a genetic component. If a close female relative, such as a mother or sister, has PCOS, a woman may have a higher risk of developing the condition. 2. Insulin resistance. Many women with PCOS have insulin resistance, meaning their bodies do not use insulin effectively. This leads to higher levels of insulin in the blood, which can increase androgen production by the ovaries and contribute to the symptoms of PCOS. 3. Hormonal imbalances. Women with PCOS typically have elevated levels of androgens, male hormones such as testosterone. These hormonal imbalances can interfere with the normal development and release of eggs during the menstrual cycle. 4. Inflammation. Low-grade inflammation has been linked to PCOS. Women with PCOS often have higher levels of inflammatory markers in their blood, which may contribute to insulin resistance and other symptoms. 5. Environmental factors. Lifestyle factors such as diet, physical activity, and exposure to environmental toxins may play a role in the development and severity of PCOS. 6. Obesity in particular can exacerbate insulin resistance and worsen symptoms. Symptoms of Polycystic Ovary Syndrome. PCOS can present with a wide range of symptoms, which can vary in severity from woman to woman. Common symptoms of PCOS include irregular menstrual cycles. Women with PCOS may experience infrequent, irregular, or prolonged menstrual cycles. Some may have fewer than 9 periods per year, while others may experience heavy or prolonged bleeding. Excessive hair growth, also known as hirsutism. Elevated levels of androgens can lead to excessive hair growth, particularly on the face, chest, back, and abdomen, This condition is known as hirsutism and is one of the most common symptoms of PCOS: acne and oily skin. Androgens can cause the skin to become oilier, leading to acne outbreaks, particularly on the face, chest, and upper back. Weight gain and difficulty losing weight. Many women with PCOS struggle with weight gain, particularly around the abdomen. Insulin resistance can make it challenging to lose weight. Thinning hair or hair loss. PCOS can cause thinning hair on the scalp, a condition known as androgenic alopecia. This type of hair loss is often patterned and similar to male pattern baldness. Polycystic ovaries. On ultrasound, the ovaries of women with PCOS may appear enlarged and contain numerous small follicles or cysts around the edges. These cysts are actually immature eggs that have not been released during ovulation. Infertility. PCOS is one of the leading causes of infertility in women. The hormonal imbalances associated with PCOS can interfere with ovulation, making it difficult to conceive. Darkening of the skin. Some women with PCOS develop dark patches of skin, particularly in the folds of the neck, groin, and under the breasts. This condition is known as acanthosis nigricans and is associated with insulin resistance. Mood changes. Women with PCOS may experience mood swings, depression, and anxiety. The psychological impact of PCOS can be significant and should not be overlooked. Diagnosis of polycystic ovary syndrome involves a combination of medical history, physical examination, and laboratory tests. There is no single test for PCOS, so diagnosis is typically based on the presence of certain criteria. The most commonly used criteria are the Rotterdam criteria, which require the presence of at least 2 of the following 3 features. Irregular or absent menstrual cycles. This includes infrequent periods, prolonged periods, or the absence of menstruation known as amenorrhea. Hyperandrogenism. This refers to elevated levels of androgens, which can be identified through clinical signs like hirsutism or acne, or laboratory tests showing elevated androgen levels in the blood. Polycystic ovaries on ultrasound. The presence of 12 or more small follicles on each ovary or an ovarian volume greater than 10 milliliters on ultrasound is indicative of polycystic ovaries. Additional tests that may be performed to rule out other conditions and confirm the diagnosis of PCOS include blood tests to measure hormone levels, including androgens, luteinizing hormone, LH, follicle-stimulating hormone, FSH, and insulin. Blood tests may also be used to assess glucose tolerance and lipid levels. Pelvic ultrasound. To visualize the ovaries and check for the presence of cysts. Glucose tolerance test. To assess how the body processes glucose and to check for insulin resistance or diabetes. Thyroid function tests. To rule out thyroid disorders which can cause symptoms similar to PCOS. While there is no cure for PCOS, the condition can be effectively managed with a combination of lifestyle changes, medication, and other treatments. The management of PCOS is tailored to the individual's symptoms, goals, and overall health. Here are the key management strategies for PCOS lifestyle modifications. Diet. A healthy, balanced diet is crucial for managing PCOS, particularly for those with insulin resistance. Focus on whole foods, including fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit refined carbohydrates, sugary foods, and processed foods, which can exacerbate insulin resistance. Exercise. Regular physical activity helps improve insulin sensitivity, promote weight loss, and reduce the risk of cardiovascular disease. Aim for at least 150 minutes of moderate intensity exercise per week, such as brisk walking, swimming, or cycling. Weight management. For women with PCOS who are overweight or obese, even a modest weight loss of 5 to 10% of body weight can significantly improve symptoms, including menstrual regularity and insulin sensitivity. Medications, hormonal birth control. Combined oral contraceptives, which are birth control pills containing both estrogen and progestin, are commonly prescribed to regulate menstrual cycles, reduce androgen levels, and improve acne and hirsutism. Other hormonal options include the contraceptive patch, vaginal ring, and progestin-only pills. Anti-androgen medications. Medications such as spironolactone can help reduce the effects of androgens, including excessive hair growth and acne. These medications are often used in combination with hormonal birth control. Metformin. Metformin is an oral medication commonly used to treat type 2 diabetes, but it is also effective in managing insulin resistance in women with PCOS. Metformin can help regulate menstrual cycles, promote ovulation, and reduce the risk of developing type 2 diabetes. Fertility treatments. For women with PCOS who are trying to conceive, medications such as clomiphene citrate or letrozole may be prescribed to induce ovulation. In some cases, gonadotropin injections or in vitro fertilization (IVF) may be necessary. Acne and hair removal treatments. Topical or oral medications may be prescribed to treat acne. Hair removal treatments such as laser therapy or electrolysis can be effective for managing hirsutism. Surgical options, ovarian drilling. In cases where medication is not effective in inducing ovulation, a surgical procedure called ovarian drilling may be performed. This laparoscopic procedure involves creating small holes in the ovarian tissue to reduce androgen production and stimulate ovulation. Ovarian drilling is typically reserved for women who have not responded to other fertility treatments. Mental health support, counseling, and therapy. PCOS can have a significant impact on mental health, leading to feelings of frustration, depression, and anxiety. Counseling or therapy can provide support and coping strategies for managing the emotional aspects of living with PCOS. Support groups. Joining a support group for women with PCOS can provide a sense of community and shared experiences. Support groups offer a platform to discuss challenges, share tips, and connect with others who understand what it's like to live with PCOS. Regular monitoring and health checkups. Regular monitoring. Women with PCOS should have regular checkups with their healthcare provider to monitor their symptoms, hormone levels, and overall health. This may include regular blood tests to assess glucose tolerance, cholesterol levels, and hormone levels. Preventive care. Preventive care is essential for reducing the risk of complications associated with PCOS. This includes regular screenings for type 2 diabetes, high blood pressure, and endometrial cancer, as well as maintaining a healthy lifestyle to reduce the risk of heart disease. Living with PCOS can be challenging, but with the right management strategies, it is possible to lead a healthy and fulfilling life. Here are some tips for managing PCOS and improving overall well-being. Educate yourself. Understanding PCOS and its symptoms can help you take control of your health and make informed decisions about your care. Stay informed about the latest research and treatment options for PCOS. Take a holistic approach. Managing PCOS involves more than just addressing physical symptoms. Take a holistic approach by focusing on your mental and emotional well-being as well. Practice stress-reducing activities such as swimming, meditation, and mindfulness to support overall health. Set realistic goals. Whether you're trying to lose weight, improve your diet, or manage your symptoms, set realistic and achievable goals. Celebrate small victories along the way, and don't be too hard on yourself if progress is slow. Build a support system. Surround yourself with supportive friends, family members, and healthcare providers who understand your condition and can offer encouragement. Consider joining a support group or online community for women with PCOS. Advocate for your health. Be your own advocate when it comes to managing PCOS. If you feel that your symptoms are not being adequately addressed, seek a second opinion or ask for referrals to specialists who are experienced in treating PCOS. Stay positive. Living with a chronic condition like PCOS can be frustrating, but maintaining a positive outlook can make a big difference in your quality of life. Focus on the aspects of your health that you can control and take proactive steps to manage your condition. Polycystic Ovary Syndrome, or PCOS, is a complex and often misunderstood condition that affects millions of women worldwide. While there is no cure for PCOS, it can be effectively managed with a combination of lifestyle changes, medications, and supportive care. By understanding the causes, symptoms, and treatment options for PCOS, women can take control of their health and improve their quality of life. If you suspect you have PCOS, it's important to seek medical advice for an accurate diagnosis and personalized treatment plan. With the right approach, living with PCOS can be manageable, and women can lead healthy, fulfilling lives.